Tracheostomy types. 1. Emergency tracheostomy. 2. Elective tracheostomy. Tracheostomy tube. 1. Fuller's bivalve tracheostomy tube. It has got outer tube and inner tube. Outer tube is biphalanged and so insertion is easier. Inner tube is longer with an opening on its posterior aspect. Inner tube can be removed and reinserted easily whenever required. 2. Jackson's tracheostomy tube. It has got outer tube, inner tube, and an obturator. 3. Red rubber tracheostomy tube. 4. PVC tracheostomy tube. Modern tracheostomy tubes are made of plastic. They are soft, least irritant and disposable. They have inflatable cuff which makes it easier to give assisted ventilation. Cuff should be deflated at regular intervals to prevent tracheal pressure necrosis. For assisted ventilation, endotracheal tube can be kept for 7 days. Beyond that period, patient needs tracheostomy for further ventilation. Indications for tracheostomy: in head, neck, and facial injuries. Tetanus. Tracheomalacia after thyroidectomy. Laryngeal edema/spasm/surgeries. Major head and neck surgeries like Commando's operation, block dissection, etc. ICU ventilation after 7 days. Technique of tracheostomy. Neck of the patient is hyperextended by placing sandbags under the shoulder. Vertical, midline, or horizontal incision is made. Deep fascia is opened. Strap muscles are retracted laterally. Isthmus is divided or retracted below. Second and third tracheal rings are opened and circular opening is made. Tracheostomy tube is placed. It is tied around the neck. Vertical midline or transverse incisions are used for tracheostomy. Vertical midline extends from cricoid cartilage to sternal notch. It is used both in emergency and elective tracheostomy and commonly used incision. It gives rapid access with less dissection but leads into pore scar. Transverse incision can be used in elective tracheostomy. It is placed 2 finger breadths above the sternal notch with a length of about 5 cm transversely. It has got a better cosmetic scar. Complications of tracheostomy: tracheal stenosis, bleeding, aspiration, pneumothorax, surgical emphysema in the neck, mediastinal emphysema. Tracheostomy dependency.